Oftentimes in life, we are in need of certain services that are offered by the community that happen to us, happen to our loved ones that are not really positive. But, it is what it is. And sometimes in life, there are situations health-wise and sometimes death-wise that are upon us, and we do all that we can to try to deal with it in as positive manner as possible. And one of those situations is hospice, terminal illness, and illness period. Well, in fact, if someone is terminally ill, or if someone is seriously ill, then I think it behooves us to be familiar with the services that are offered for these individuals. And one of those services, particularly for terminally ill and very sick people, is hospice. And today we want to talk about that. And it's kind of like, people don't like to talk about death. They don't like to talk about funerals. They don't like to talk about caskets. My roommate Connie Kayla's in the casket business, and I tell him I'm not a candidate, but it's a fact of life. These things, they're inevitable, really. Death is anyway. So what we want to do is try to, with this show today, is to impart some information so we will be familiar with, what to do, what the conditions are, what the requirements are, what the circumstances are, and some of the best approaches to making life as easy and comfortable as possible, particularly in our last days. This is a call to action.
This is call to action.
I'm your host, Alex Habersham, and I have with me today Miss Shirley Wesley Lawson. I'm looking at all these titles, RN and VSN and all of these things, and she deals with hospice and on a daily basis. So I'm just glad to have you. This is in a series of interviews that we are having as it relates to medicine and prevention and treatment and things of that nature, particularly with Navicent Health, who's one of the sponsors in many instances of not only this show, but also many other events in the community. How you doing?
I am great.
Yeah, thanks for coming on the show.
Well, thank you.
Yeah. Tell us a little, before we get to the not so happy news, tell us a little bit about yourself.
Well, I was born and raised in Macon, Georgia, that I love. I have been a nurse 40 years next year. I graduated from Albany State University.
You must have been when you got your nursing degree when you were 12.
Thank you. I went to Albany State University. I graduated in 1978 with a degree in nursing. I stayed in Macon and worked 1 year. I decided it was time for me to see the world. I was a military nurse about 8 years.
Wow.
Traveled to Guam, the Philippines, all around, enjoyed myself, but there's something about home, and my parents were still living, and I was missing so much of home. I decided that I would move back here. I brought my husband, who was a native Californian, brought him back to Macon, Georgia, good old Macon, Georgia, and then I started to work for Navicent Health in 1990. And in the meantime, I did continue my service as a reservist, and I retired from the United States Navy Reserves as a commander, and now I am over 60, and I am receiving my paycheck, and it is great. So Macon, there's no place like Macon. Macon has such a rich history, and we have to just get out and learn. It's so much to do in Macon.
Right. Well, a couple of things. First of all, thank you for praising my hometown.
Our hometown.
It's my hometown too. And also thank you for serving.
Thank you.
I really appreciate the service, and we're very close to the Veterans Day observance.
Yes,
and I
last
certainly,
week.
on behalf of the community.
Thank you.
You played an important role being a nurse in the military. And I just really, really appreciate those individuals who provide. And you provided double service. You served the country and you served those individuals that you were treating. So I really, really, really want to express my deepest appreciation.
Well, thank you
for your service.
Thank
now,
you.
Are you called a hospice nurse?
Yeah, well, we're called. I'm called a hospice nurse now, but in nursing, that's the thing that's great about nursing. Nursing has so many different avenues. It's one of the most diverse fields. If you become a nurse, if you want to, you could be an administrator. You could be a psychiatric nurse. You could be on a cruise ship. You could be in a hospital. You could be in a school. You could be a flight nurse. You could be in the military.
Wow.
So nursing, that's why a lot of men have started to become nurses. They kind of figured out that golden treasure of nursing. Nursing has so many diversity. Bedside nurse to a nurse practitioner, somebody advanced practice, a nurse anesthetist that put people to sleep, or you can even have a PhD and be a college professor. So nursing is one of the strongest, one of the stronger professions that you can be in with diversity.
Wow.
And the pay is not bad.
Yeah.
Pay is not
well,
bad.
I hope you young people hear that, because those of you who are wondering what field to go into, then Miss Shirley says that you ought to strongly consider nursing. Well, let's talk about, so have you always been, a hospice nurse, or
No.
have you always worked in hospice?
No, I have been a nurse almost 40 years, and when I first came back to Medical Center of Navicent in 1990, I was a surgical nurse and did trauma, 3 to 11, all kind of trauma, all kind of surgeries, and I stayed there until about 5 years ago, and I transferred to hospice. And we always say that hospice is the kind of nursing you do when you have had a chance to come to grips with yourself, because a lot of young people can't deal with death and dying, especially. That's sort of hard. So we have a very mature staff out at hospice, people that are not so bothered by, because sometimes as we go on, we learn that life is not 1, 2, 3 ABC. That it might go 5, 6, 7, and that sometimes when young people, when they're trying to discover themselves, they don't do well with a lot of diversity. And so we have in our company, all of our nurses have at least 15 years of nursing experience. We always say all good nurses go to hospice to roost, because we have a feel that if a patient needs something and it's not by the pattern, we're able to adjust and do whatever it is the family needs. And hospice, as we learn that as sure as we live, we will depart this life. We will live. And we will leave. And we have found out that, years ago they used to think that children were like big adults. But as technology has changed and as we have learned more, we learned that dying is a specialty, and that we will surely, all of us, going to pass that way. So we're learning things that make life as enjoyable or easier as we transition from this life. So hospice is one of those services. In order to qualify for hospice, you have to have a life-limiting illness with the prognosis of 6 months or less without treatment. So what that means, a lot of people think that you have to have cancer to be on hospice, but hospice can be people with end-stage dementia, Alzheimer's, heart disease, dialysis, end-stage kidney disease, people not eligible for transplants. So it's a lot of things, malnutrition. So it basically says if you don't have some type of treatment to intervene, then your life will be 6 months or less. But We do have some people that graduate off hospice. We do have some people that get better once they start getting like consistent visits and treatments, and some people do graduate from hospice and get better. And we have people that stay on hospice. We have had people stay on hospice 2-3 years because only the big man knows when we're going to, hey, only the big man knows the day or hour that we're going to check out. So it's not just limited to people that have cancer or other terminal diseases.
Okay, now, so, I mean, that's interesting enough. Now, let me ask you a question. What's the difference between palliative care and hospice? I've heard a lot of conversation about, and they say that there is a difference in the two.
There is a difference in hospice. Usually your diagnosis is usually, they feel your prognosis is 6 months or less. What palliative care, say somebody got a new diagnosis of lung cancer, but they think their life expectancy probably will be a couple years. So you can put them on palliative care. They have a life-limiting disease, or they have a process that they might be, that could take their life, but they're not actively considered 6 months or less. They're not actively dying.
Right, right.
So, and they're finding out too that some of the people, if you have diagnosis, and the earlier, it's just like prevention. The earlier you find out and start working on to make, you can have some good quality of life. And then they're finding out too, after people get stronger and better, that sometimes, it used to be the word cancer was a death sentence. If you heard the word cancer, you went to the funeral home and started making your plans. But now that word cancer, and especially with early diagnosis and treatment and all the technology, that cancer anymore.
Talk a little bit, and I'm glad you said that. Unfortunately, less than 2-3 months ago, I had a brother, who passed because he had colon cancer. And the interesting thing is that, the symptoms were too far gone, when they discovered. Because now he lived, speaking of it, he lived 5 years after it was discovered.
Right.
And he went through palliative and hospice and things of that nature. But talk about a little bit about early diagnosis, and talk about the habits that we should exercise, including me, in order to, to live longer and not be as sick, and what kind of examinations should we get. And incidentally, I've got a colonoscopy Monday because my mother had colon cancer, and then I just had a brother that passed from colon cancer. So talk about prevention and diagnosis in an effort, not to go to hospice or palliative too early.
Okay, well, the thing about it is, a lot of times we think that people don't go to the doctor because they don't have insurance. But I think sometimes some of the people who don't have insurance are usually scared that they might get sick, and they go to the doctor more than people that have insurance. You have a lot.
So it's the reverse, huh?
Yeah, I think there's a lot of people that have insurance that don't go to the doctor. It's not that they can't afford to go. They haven't been in a long time, or they don't really like to go to the doctor. And because sometimes, like I say, you'll find out people, they'll still treat them in an emergency room, but sometimes those people are afraid that they're going to get sick. So some of us that have good insurances are the people that don't exercise that preventative care. So there are some things that now, preventative care, the cancer that kills more people than anything is lung cancer. While women have diagnosed more with breast cancer, and men more with prostate cancer, but it's not killing people like it used to be. And the reason that lung cancer kills more people is because by the time if you don't have it discovered on something, sometimes accidental, by the time you start having symptoms, that lung cancer, pancreatic cancer, ovarian cancer, by the time you start having symptoms, then you might be already stage 3, stage 4. So there are some...
Let me interrupt you.
Uh-huh.
So now, is there a way to test for it or to diagnose it, or are they in the
Pancreatic,
blood?
not yet. They're working on it.
Not pancreatic. How about lung?
Lung cancer can sometimes be discovered early by having if you're having a physical, having a routine x-ray of your chest. And then sometimes what happens is people start having symptoms, chronic cough, maybe coughing up a little blood, not feeling well, and they ignore it.
And they're scared to go to the doctor.
That's right. They ignore it, and we ignore stuff sometimes. But a lot of times, sometimes lung cancer, people have had a cold, went and they x-rayed the chest, and they have seen. So your body always tries to heal itself, and your body's always trying to tell you something, but sometimes, we don't listen. We don't listen. Yeah. So there are some things that are general in place for what they recommend for screening, having breast screenings, prostate screenings, PSAs, colonoscopies. If you are, at least when you're 60, if you have a family history, then you should have a colonoscopy. If you have any brother, you should have a screening. Sometimes they recommend as early as 50, and if you're having symptoms, most definitely, so that you can get like a baseline. So if something changed, then they will have some idea as to, where you are. So if you have a strong family history of some things, they are also doing now some genetic testing too. So if you have strong family history, and if you start having any kind of symptoms, you need to go and get that checked out.
Now, so what I'm hearing you say is that, you can almost tell your possibility of certain diseases through what has happened to members of your family. For like I told you, my mom and then my brother, and then that's why. Because I had one 5 years ago, and because it was really a little more than 5 years ago, but not too much. So then, I'm not afraid to go and get another colonoscopy because
they recommend, if you're under 70, they recommend, if you have the first one at 60, then the next one 10 years. But if you have a family history, then they recommend every 5 years.
Right.
So if you have family history, or if something changes, you just, it behooves you to go and just get it checked out.
Yeah.
Mm-hmm.
Not one, what is the process of getting into hospice and palliative?
Okay.
Now, should they be used separately? I mean, are they two separate divisions?
They are two different things, but they work hand in hand. Because some people, you have a lot of doctors that work in palliative and hospice. They're close enough now. They're close enough that they work hand in hand. It's just that hospice is 100% funded by Medicare. 100% funded. So palliative, if you don't, have some, it's not 100%. Once you get on the hospice program, it is 100% funded by Medicare. And with Navicent, they will take you whether you have money or not, or whether you have medical care. It is a nonprofit, just like the Navicent main hospital. Some of the hospice are for profit, but Navicent will take you regardless of whether you have insurance or not. So that's not one thing that keeps you off of hospice, but it is 100% funded, and that includes the hospice team includes the doctor. It's like an interdisciplinary team to take care of you spiritually, physically, socially. It's a team with the doctor, social worker, nurses, chaplain, to take care of the whole person and the family. So, and it provides 24-hour a day care, 7 days a week. And it also will pay for part of your medicines, your supplies, like if you need personal care stuff like diapers, bed pad. It also will provide somebody like a home health technician if the person needed help with their personal care, like baths, feedings, medical equipment, beds, wheelchairs. So all of that is wrapped into the hospice program. Now palliative, because usually if you are in palliative, you're not at the place where you might be confined to a bed or that restrictive. So the equipment, most of palliative is billed to your regular insurance, where hospice is one of the things that's covered by Medicare.
Okay, so tell me how hospice work. Do they stay in the hospital, or do they?
No.
Is it home? Or?
Okay. Hospice, in order to qualify for hospice, your doctor has to say that you have a life-limiting illness. And then they do a certification, and then they get you qualified. And then we have people that are on home hospice. A lot of people are on home hospice, meaning that they're taken care of in the home by the family. And then Navison has right now the only freestanding hospice house. And usually you come to the hospice house.
Is that where you are?
No.
Okay.
I do home visits at night.
Okay.
I go from house to house. Right. And you usually come when you're like 2 to 3 weeks within dying. Or you can also come for...
Now, if a person is in like home hospice, but they get very, very close.
Well, you can come if you get very close. If you're at home and say you're having pain, for symptom management we call, like if you're having pain, a nausea that can't be controlled, they get that control, and then you stay there, and then you go back home. Or say you were going out of town for a wedding, and then you needed somebody to take care of your mother. Well, they can come for 5 or 6 days at a time. It's called respite. Or say you're so exhausted that you need to rest, so they can come for a respite for the caregiver to rest.
In the home? They can come
at
in
the
home.
hospice house.
At the hospice house?
Right.
But not in the home?
Right. They bring them to the hospice house.
Okay,
Because if they're at home, you're not going to get any rest. So
but suppose I want to leave town.
You leave town, but you bring your loved one to the hospice house.
You bring them to the hospice house.
Right, honey. Yeah. They keep them at the hospice house. Yeah. For you to do whatever. Yeah. If you got some type of emergency or whatever.
But there have been instances where a person, and I think I heard you mention that, was on palliative, and then because of treatment and technology and habits and what have you, then they can generate a longer expectancy.
Right. Okay. Because sometimes when people are first, say if you were diagnosed with lung cancer or colon cancer, like your brother, and they say, you got 3 years to live. Well, you might be covered by palliative, because palliative wants you to live as productive as possible. You would be covered by palliative until you got within 6 months of what they thought might be, and then you would transition to hospice.
Well, that's interesting, because they gave my brother 5 years, and I didn't know. And that's the other thing. Talk a little bit about, how people are reluctant, to that in being ill. Talk a little bit about that, because sometimes, okay, now, what role, in your opinion, does one's psyche, being psychologically okay, what role does that play in healing and in affecting your body? Does it? Some people say, you can make your mind up and you can influence your body through your thoughts. Well,
they found out that usually people that are positive and are a fighter, they do much better. Because the thing about it is, if you are depressed, it's going to affect you all over, for its pain, for its medicine, for its anything, that if you're not well, I mean, you can have some days that you just feel bad and don't go out, and you're just sick in the house, and nothing really seriously wrong with you, but you can feel bad, and some people can feel so bad, and you know that some people, anyway, illness. A lot of it depends on you in a fight, so you have to have that, you know. Let's make the best of whatever I have,
right,
you know, because that's just, I think that's just the way to live.
Yeah. Well, let me tell you something. I'm just absolutely in awe of your interest and your knowledge and your spirit, because one of the things, and see, you can't fake caring, you know, and in order for people to be effective and in order for you to make your patients feel good, they got to know you. It's kind of like a kid. You know, a kid, you know, like teachers. Children know whether or not teachers really care.
Right.
You know, so that's very, very important. So
my philosophy, I think of Dr. Martin Luther King, and I can hear Mahalia Jackson saying, if I can help somebody,
yes, ma'am,
as I pass along,
yes,
if I can cheer somebody with the word of song, if I can show
somebody
that they're traveling wrong, then my living is not in vain. And you have to have a love and a zeal for what you do. And you can tell those people, whether they're teachers, lawyers, whatever, those who don't have a zeal for what they do. You can tell those people, you know, like those old school teachers we used to have, like at Ballahus and L.H. Williams and all those places. Those people that's right, B.S. Ingram. They had a passion for what they do. And if you don't have a passion for what you do, it is a job.
You cheating somebody.
It's a job.
Yeah, and
it's not your avocation. Yeah. It is a job, and you will do it like a job.
What if somebody would be more interested in finding out more information?
Okay, Macon has a lot of hospice. Macon actually has more hospice per capita than any other place in the state. I think Macon has about 13 hospice, but Medical Center or Navison is one of the ones that are not for profit. So all you have to do, you can look it up. It's Facebook or call Navison Health or look in the phone book and you can find out. And I encourage everybody, make sure before you make a decision, do your history, because a lot of times what we do as people is my doctor says. But it's not up to the doctor. You're going to have to be the person that's going to be satisfied. So make sure you do your research before you let your doctor decide you're going to sign on the dotted line.
Well, believe it or not, our time is up.
Okay.
Yeah, and you have done, like I said, you've done a phenomenal job. And this is a call to action.
This is a call to action.
I've been interviewing Miss Shirley Lawson. That's good enough?
Yes.
Yeah. Who is a RN, and she's also a retired colonel, you said?
Commander from the Navy.
Retired Navy commander who also is a hospice nurse, among other things. And I just want to thank you for your interest, your knowledge, your education. And we certainly express our appreciation to you and whatever you do. And if, in fact, you have a family member who qualifies for either palliative or hospice care, then you can look it up and call one of the facilities, or you can call Navison Health and just ask for hospice.
Just ask for hospice.
And they will direct you to the proper channel, to the proper department. This is a call to action.
Call to action.
I'm your host, Alex Habersham. Have a great day.